Hey guys, okay, I wanted to do an 8-month update on my jaw surgery because I'm almost at 8 months right now, so I thought it would be a good time, and I'm going to be pretty busy this week, so I probably won't update. What do I want to say? Okay, so I saw my surgeon. I still haven't made a post about that, but I'll just say right now. I went to go see my surgeon for one of my checkups, and he checked everything out. He checked what was it? I was telling him that I was having TMJ pain on and off. It wasn't all the time. Like before jaw surgery, I had TMJ pain all the time, and now it's kind of just randomly once in a while. Usually when I'm stressed out and stuff, I'll have pain. So I just want to talk to him about that, and he said that when that does happen, what I have to do is I have to go on soft foods or liquids, and take Advil during the day and take Robaxacet at night, and I have to do that for a week so that my joints can I guess recover or settle, because if I keep chewing and doing things normally, then it's just going to keep aggravating it. So that's what I have to do. What else did I want to say? Otherwise, I also told him about how when I was at the hospital, I had this injection in my hip, but I don't know. I had this injection at night, and it left kind of a scar, but not really a scar. It's there was a hole. So I don't really know what happened, but he checked that out, and he told me to tell my doctor too. I told her about it. But I guess it just warped the fat or something, because they have to give it to you in a fatty place. So I was actually in my butt. So that spot there, it I don't know, warped it. But it's just a patch that's really, really weird. I haven't really heard anyone say that before, and my surgeon said that he had one other patient before that had this thing happen. So I just wanted to tell him, because I don't know if it's normal or whatever. Otherwise, oh, it's really hot in here. I gotta open a window. I'm right beside my window anyway because the lighting is better. It makes me look really pale. What did I want to say? Yeah, so anyway, I saw him, and then I probably won't see him again until October, I think. So it's going to be a while. I'm still adapted to my face. I noticed the past few days, I had a family friend who told me I look really, really different. She forgot that I had jaw surgery, so she just kept saying, she's like, you look so different. She's like, what is it about you? She's like, you look really different. I'm like, oh yeah, I had my, jaw surgery. She's like, oh, is that it? So that's pretty cool, because I find a lot of people, especially people who've seen me throughout the whole process, saw me look the way I used to look, then all of a sudden I look like I got hit by a bus, and then it slowly went back to normal. So they kind of just adapted to it slowly and didn't really have that whole before and afterwards, wow, big difference. And my doctor said too, she's like, oh yeah, you had your surgery. She's like, wow, she's looking, she's like, you look really different. Because I haven't seen my family doctor since last year before my surgery. So she said everything looked really good. So that's pretty cool, because I don't know, it's when you go through something so big like that and you look at yourself and you're like, wow, I don't really fully recognize myself, but other people are telling you you look the same. It's kind of a little bit discouraging, because I'm like, okay, well, I didn't really like the way I looked before because my jaw was really warped, so I kind of don't want to look the same as I did before, especially after going through hell and back to have this surgery and going through the recovery and everything. It's you just want to, it's just nice to hear compliments about it, because I find I'm still adapting. I'm 8 months post-op, but to me, I don't know, I look at old pictures, and some pictures, because I know a lot of people agree with me on this, before you have jaw surgery, you compensate the hell out of your face to try to not make it noticeable that your jaw is messed up. People with underbite, you usually angle your face, especially pictures and stuff like that. You're not going to do a picture that's from eye level or below, because you're my jaw is going to look huge. People with overjets usually push their bottom jaw out. You just compensate for it subconsciously, because it'll look normal, especially if you're taking pictures. So a lot of my pictures before surgery are just angled in a way that you cannot see how messed up my jaw is. I swear, I'm going to go through, once my braces are off, I'm going to make a video of my before, throughout, and after, just like pictures, just to show you guys how different everything is. And I know it's really good for people who haven't had the surgery yet, because it's so hard to imagine what changes might happen to your face. And I know I was like looking like crazy for before and after pictures and videos. I was like, I don't know, that was like my goal in life, was just to find like people with my jaw issue and see what they look like after, to see what I can expect. So I think it's really good to share your story and share your pictures. And people in the whole jaw surgery community are really, really nice, because they're going through the same thing as you and they know how hard it is. So it's not like, I don't know, it just helps if we're all, you know, nice to each other. But what was I saying? Okay, so my before pictures, I have some of them, like most of them I'm compensating, I'm posing in a way that makes me look not so messed up. But I have some of them, like the pictures that never get posted anywhere, and anyone who has jaw surgery, you know these before pictures that never ever leave your computer or your phone or your camera, because they are so just awful, because they completely show everything that's wrong with your jaw, like just the wrong angle or side profile or something, and you're just like, this picture is not going up. So I have to go through, I have a lot of pictures like that have never left my computer, that I don't even remember because they're that bad. So I'll have to post some of those up and just show before and after of like the same angle, to see like, you can see like the difference. Because when you go and you put like a head on, like, oh, smiling, whatever, pretty posing, then you can't really tell how different your before and afters are. But yeah, I don't know, I'm really happy with everything. I'm still adapting though, like it's weird for me, because I think the biggest change with me is before surgery, I had a really hollow face up here, my chin curved back, and my nose was so narrow. Like my nose, I can't even fake what my nose looked like before, because it looked narrow. And my nose it's not, like my surgeon said too, he's like, your nose, you're going to notice, is going to be wider and it's going to be more upturned, but you might not be able to notice it. It's going to be very slight, but I notice it, especially just being wider. I notice even the bridge used to look really bony and thin, and I guess because of moving the front of my face up, it looks a little bit wider, which I'm happy with. But this part down here still looks wider than it used to before surgery, and I'm just adapting to it. Because to me, having such a narrow nose before surgery, seeing it after, I'm like, oh my god, my nose looks huge, even though it doesn't. It looks like a normal nose, but it's just in comparison. And I noticed too, like it's 8 months post-op, but I don't know if I still have swelling in here at all. I had that awful infection on this side, so maybe that side is more swollen than this side. I think that's what it is, because you can see where the light shines, or where the light hits it. This cheek has just been a pain, but I still have, I guess I still have scar tissue and everything's going down. My lower mouth is completely different. Because of the genioplasty and the lower jaw surgery, my whole lower face is just completely different. Like my jaw is on a different angle, it's a different shape, everything. And I'm still really numb. It's really weird. Like, I think the numbest I am is around here, and my lip is just like, it's like a piece of rubber. It's really strange. I know a lot of people ask about that, like, is that something that would make you change your mind about having jaw surgery? But no, like, I don't know. Right now at this point, like, if I think about it, it'll drive me crazy. But I just try not to think about it and don't really let it get to me. And then it doesn't really bother me. I don't really notice it that much. I notice with hot and cold, if it's cold outside, if I don't know, like things like that. Usually if it's cold outside, I notice that it feels really stiff. Like right now I just opened my window and my lower face feels extremely tight. So it's, yeah, it's different. But it's not that bad. Like compared, the trade-off is completely worth it, because I was so crappy before surgery and just so many things were wrong before surgery that to have a little bit of numbness isn't a big deal to me. Like I was one of those cases that was pushed more into having surgery because of my pain and it wasn't so much just like the way I looked. But I had really, really, really bad TMJ pain. I was having so much trouble chewing. I was grinding down my molars. My teeth weren't hitting correctly anywhere. Like, my bite was just a mess. So it's like completely different now. Like, now I close my mouth and it has one place that it closes and it sits there, and it used to slide all over the place. I used to have to sleep with something supporting my jaw. I couldn't sleep on my back because then I'd have like sleep apnea issues and I wouldn't be able to breathe, or I'd wake up in the middle of the night and my throat would like collapse and I'd be like trying to breathe and nothing would be happening. So I stopped laying on my back a long time ago when I started having those problems. So I'd sleep on my side, but because my jaws didn't fit in, my jaw would always end up falling to one side or another. Like, it never had a spot that it fit, and it would kill. I'd wake up with the worst pain. So I used to have to take like a towel or a pillow or something and support it under my jaw, or I'd just sleep with like my fist under my jaw to keep it from falling out of place, which sounds really weird, but it was really, really awful. So it was kind of like a 24-hour like ordeal with my jaw before surgery, and now it's just something I don't have to think about, and it's so nice not having to think about that. I feel like I can finally live my life and not have to worry about this stuff anymore. So I'm really happy about that. I'm really hoping that my next video will be metal free. I still have this. I still have my braces. I have the clear ceramic, so they're not nearly as noticeable as when I had my metal braces, because I've had braces more than once, like a lot of jaw surgery patients. But I'll be very happy to have them gone because I'm so sick of having food stuck in my teeth all the time, and the pain it is to clean these things out. And it's awful. Anyone with braces knows how annoying it is, and you can't eat out in public without having to worry about something stuck in your braces, and there's always something stuck in your braces, especially when you don't want anything to be stuck in them. So I'm really happy that I'm at the end of my journey, and that it's finally like just coming to a close and I don't have to think about it ever again. Yay! At least I hope not. My jaw's, it's been really, really stable. Like, my surgeon, my orthodontist, everyone's been saying that my bite is fitting perfectly. It's exactly where it should be. I do need to start speech therapy, and I'm very bad for not having done this already, but I just keep getting so busy with school. Like, my terms practically overlapped because I had finals, and I had a final deferred that ran into my new term, and now I have midterms, and I'm just never done. So I want to like not be stressed out and just be able to focus and I want to start speech therapy soon to try to, I've been a lot better with tongue thrusting, but I do still tongue thrust when I'm not thinking about it or when I'm sleeping, because I'll notice, like, especially when I'm stressed out, and it's a really bad habit I've had for a really long time, but when I'm nervous or stressed out, I push my tongue on my bottom teeth, which is probably what caused my lovely underbite. But it's really, really bad. So I'm trying really hard. It doesn't happen nearly as often, but I still need to see a speech therapist because, I mean, I don't know. There's probably like other things that can help, and I'm not sure exactly how my speech is, because I had a lot of speech issues before jaw surgery. I think that's improved too, but I mean, I think everything can always be better. So anyway, before you guys get extremely bored, and most of you probably already stopped watching by now, I'm going to end this video, and I will update hopefully when I am brace free. I hope. You hope too, because I'm sick of these. Okay? Alright, bye guys!